A lot of people in this room have heard me talk or heard others at KHF talk about what we now call a three-part purpose. I want to share it with you again tonight, but also paint the little deeper picture about why we are so focused on this three-part purpose and what I believe we can accomplish we together. Part one of the purpose is to help Kansas lead the nation in health. It can't just be rhetoric. The idea that a state could lead the nation in health, the idea that we could be that state, that we should be that state and will be that state, anchors the first part of our purpose. But here's the challenge. We can't make progress. We can't climb those health rankings just by helping healthy people get healthier. The second part, and in a minute, the third part of that purpose is completely connected together. So the first part is to lead the nation in health. I believe Kansas can do that, but we can't do that if we in this room and well beyond this room don't eliminate the inequities, eliminate the barriers that some Kansans are facing, that frankly others aren't facing, that get in the way of a thriving, healthy, full life. Lead the nation in health, but to do that, we must eliminate the inequities that create health disparities. But the third part is all about innovation. It's to become the model for impact. And that's us. The people in this room tonight are the people in Kansas who care, who think, who work on this all day long. And yes, let's bring the best practices to Kansas, of course. And if we want to have a shot at leading the nation in health, if we want to have a chance to eliminate inequities that plague our communities, we have to become a place. We have to become a group. We have to become a place that not just brings the best practices, but together invents the next practices. We simply can't achieve what we hope to achieve if we don't become the model for impact. But there's a lot of good news, and there's a lot to celebrate, and how fun it was to hear Aubrey and Jonathan upstairs talk about amazing things happening here in Topeka or in Hutchinson. And every single one of you here has things that you could celebrate. Amazing work happening in Kansas to improve the health of Kansans. Brandon is here from the Sunflower Foundation. I can't see you right now, Brandon, but the Sunflower Foundation, as an example, has pioneered the integration of primary care and behavioral health, a phenomenal initiative to create a type of collaboration that makes so much sense, and a type of collaboration and initiative that should be celebrated, that should be invested in, and that should scale across Kansas. Or Joe is here somewhere from Stand Together. Stand Together down in Wichita has literally created an army of people who care deeply about foster kids in Wichita, our most vulnerable kids. And they are on the ground changing the reality for our most vulnerable kids in our largest city. It is phenomenal. Other stories too. Bishop Wilson from the United Methodist Church. There are hundreds of United Methodist churches across Kansas. And yes, they continue to do what the bishop would call mercy work, to help those in need. And they are doing more and more and more what they would call, and I would call, and I think we would call justice work. So many things to celebrate. And the list could go on and on and on. And we will celebrate. And there's not all good news. In the health rankings right now, we're 29th in the nation out of 50 states in health. Now, if we had been 49th and we were here tonight at the position of 29, we would be celebrating. We would be knocking on the door of breaking into the top 25. We would be celebrating where we've been, right? Patting ourselves on the back and looking towards the future where we're headed. But that is not our story. 1992 was the last time we were in the top 10. We've been falling steadily ever since, and now rest at 29. And it doesn't take a rocket scientist to help us understand if something game-changing doesn't happen, that slide is going to continue. I want to try to paint that picture a little deeper for you about what it means to be 29th in the nation. All the different little sub-measures also have rankings. It adds up to number 29 for Kansas. But I want to shine a light on some of the particulars. Kansas right now is 38th in the nation for the number of Kansas children who experience 2 or more adverse childhood experiences, ACEs. Most of you know what ACEs are. We are 38th in the nation for ACEs. Kansas is 42nd in the nation for occupational fatalities. This is one of the most dangerous places to work in America. Kansas. And you might think, well, that's got to be the ag economy, it's got to be the manufacturing base we have. No. Our surrounding states have that same base economy. All of them rank so much higher in that particular submeasure. 42nd. Kansas is 42nd in air pollution. Nebraska is 8th. Here's the one that I'll end on, not the whole speech, sorry. The one I'll end this segment on. We are 43rd in the nation for the particular measure of low birth weight racial disparities. 43rd in the nation. This is one of the riskiest places to be born if you are a baby of color. What's interesting is when you just look at the other metric of just low birth weight, we're 13th in the nation. Think about that for a minute. Think about what that means. If you're a white baby, pretty safe place to be born. But if you are a baby of color in Kansas, there's a lot of risk to being born here. Unacceptable. But I want to paint a picture. I want us to imagine what being number one could look like. I want to try to make that real for us. It can't just be rhetoric. And so to make it real, what I want to do is talk about real numbers that would be different if we simply had the same results, percentage-wise, of the number one state in the nation today. So number one right now is New Hampshire, okay? And by the way, if you're at the Kansas Health Foundation, you're walking down the hall, you might hear somebody say something along the lines of, down with New Hampshire. Right? We actually don't wish any ill health on the people of New Hampshire. Bishop, please forgive me wherever you are. But we also know it's good to have an enemy. It's good to have somebody to shoot for. It's good to have somebody to look at and say, we could and should be there. So here's what I mean by that. If we could match the healthiest state in the nation right now on the number of kids in Kansas experiencing ACEs, 16,000 fewer kids experiencing the trauma in Kansas, 16,000 fewer kids in Kansas experiencing the trauma of having multiple adverse childhood experiences. 16,000. We just matched New Hampshire. Let's talk about early literacy. Incredible efforts underway with early literacy in Kansas right now. Okay? If we just matched New Hampshire, there would be 32,000 more kids currently in our school system. 32,000 more kids that would be reading at grade level. That's 32,000 more kids who don't need a tutor, who don't need a paraprofessional helping in the classroom. 32,000. If we could just match the healthiest state in the nation. Hunger. Let's take that one for a minute. If we could just match, this is actually an area we do quite well. The percent of our population that is food insecure, we do pretty well. But if we could match New Hampshire, the healthiest state in the nation, there would be 105,000 additional Kansans who have food security. Think about that. 105,000 more people who would not be worrying about where their next meal is coming from. Some of those are kids who are showing up at school hungry. 105,000 more, if we could just match New Hampshire, the healthiest state in the nation. Two more, exercise. If we could just match the healthiest state in the nation, that would mean for us 173,000 additional Kansans getting the recommended amount of exercise they need. Think what that would mean for the reduction of chronic conditions. Think about that, what that would mean for expanding lifespans for people. Think about what it would mean for happiness, for families, for communities. One last one. Substance abuse. If we could match New Hampshire, the healthiest state in the nation, 183,000 fewer Kansans would be experiencing substance abuse. 183,000. Think about that. Think of 183,000 people, some of which are already suffering the ravages of addiction, many of which who could be on that doorstep. 183,000 fewer. Think about what that does for families, for communities, for our workforce. So this idea of leading the nation in health, it's not rhetoric. It has consequences. The slide from number 8 to 29 has had real consequences. Frankly, likely not for people in this room, but for so many Kansans. But here's the surprise. Right? So if you don't remember anything else tonight, I hope you'll remember this. This isn't actually a health challenge. It's not a health challenge. We talk about it like a health challenge. It's actually not. It's a leadership challenge. Okay. And here's how you know that. Here's how I know that. It's a leadership challenge because there are people, there are experts who literally know what to do. They literally know what would create more health in a neighborhood, in a city, in a county, in a region, in a state. Some of these people are here tonight. Elizabeth Ablaw is somewhere here tonight. Elizabeth is one of the most brilliant people. Where are you, Elizabeth? Right, there you go. Elizabeth is one of the most brilliant minds when it comes to knowing what is it that needs to happen to go from 29th to 1st. We have two cabinet secretaries with us tonight. Secretary Stanek and Secretary Howard are here somewhere. They know, and they have people who work for them who know so much of what needs to happen. So you know it's a leadership challenge when there are experts who know, but those people don't have the power, the authority, the positioning, the ability to implement the solutions. That's how you know it's a leadership challenge. It's about health, yes, but it is a leadership challenge for all of us. What I mean by that is, if we don't get more people to care about what we're talking about tonight, if we don't broaden the tent of people who care deeply about this journey to leading the nation in health and understand the results of the slide that we've been on for 25 years, if we don't mobilize more people to care who currently don't, if we don't get more people to engage who currently aren't engaged, if we just have the people who wake up every day, get paid to work on health, caring about the future of health, we'll keep sliding. It's not a health challenge, it's a leadership challenge. One for each and every one of us. Cole, I don't know if Cole's in the room right now. Cole in the back. Another round of applause for Cole, our artist upstairs. Cole, you are amazing, and we chose Cole to be here tonight because we loved the way his painting, each line gets laid on that canvas, and it made us think about each program, each initiative, each time one of us exercises leadership, each one getting laid down and together creating something magical, a whole that's greater than the sum of the parts. So it's a leadership challenge, not a health challenge. And that's why we've created HealthRise, this event tonight. That'll be an annual event. We know, and by the way, this is not the first time that Kansans have made game-changing progress on what felt like impossible issues. So let's not pretend like this can't happen. Some quick examples. Patrick, I see Kenny out there somewhere, Melissa's out there somewhere, Speaker Reichman is out there somewhere, Minority Leader Davis is out there somewhere. Education funding, 10, 15-year journey that a lot of us were a part of, totally transformed our approach to education funding. One example of transformative progress. But others, 1989, Kansas had the worst transportation system in America, the worst highways, to having the best in 1999. We should look at the times when we totally remade our higher education system in 1998. These things can happen, and they have happened. So don't let yourself believe it's impossible to go from 29th to 1st. We created HealthRise because we believe that we, the collective we, in this room and those who aren't able to be here tonight, need a place. We who care deeply about this journey to leading the nation in health, we need an anchor moment. We need a moment where all of us who care so deeply about health in Kansas, we can get way up on the balcony together. We can get a bird's eye view and look down at Kansas and celebrate what needs to be celebrated. See the gaps that exist. Cast vision together about what must happen next. We need that space. That's why we've created HealthRise. So in that spirit, I want to make two calls to action tonight. Just two. The first one is I want you to take a page out of the playbook of the Kansas Hospital Association. Where's Chad? Chad? Thank you, Chad. Take a page out of their playbook. Take a page out of the Community Care Network's playbook. Sonia's right here in the front. Take a page out of the Kansas Health Foundation playbook. Here's what I mean by that. I'm asking you to do what those organizations have done by getting clear on how you and your organization can connect and center the health rankings in your work. So for the Kansas Hospital Association, it's a clear strategic aim in their framework to help Kansas climb the rankings. For the Community Care Network, you've got to hear Sonia talk about the journey to number one. If you want to be inspired, listen to Sonia. Where are you, by the way? You're here somewhere. Right? Yeah, the journey to one, right? So here's the first ask. We meaning those who care deeply about improving the health of Kansas, we need a North Star. I don't know how you make game-changing progress without one. The rankings provide that, but we need more organizations to understand how they connect to them. If we work together to force this ranking always in front of us, if we don't let ourselves forget how we've slid, I promise you, it will provide the North Star necessary for game-changing transformation. So that's the first call to action. The second call to action might be a little silly, but I think it's really important. You're going to receive, as you leave, a little coin. And on that coin is the number 29. Roman's right there in the back. Roman on our team created these coins for us. I keep this in my pocket. Number 29. By the way, around the edge, the top 10 states. We're going to create another coin next year with whatever our number is. We'll make sure you get that coin in the next year, in the next year. It might be a little silly. I'm going to ask you to keep it in your pocket. It matters. And what I do, I keep it in my pocket. And when I'm having a day like we all have, most of our days, where I feel busy, maybe not always productive, but busy. And by the way, for the last 25, 30 years, there have been a whole lot of people working on health who have been very, very busy. Okay? So when I'm having one of those moments where I'm feeling overwhelmed with the busyness, I just take it out and I put it on the desk. In a meeting, by myself, to try to help myself remember there's a difference between being busy and productive, and it matters. And 29th is unacceptable. My second ask is that you'll keep the coin in your pocket. Just a minute, we're going to show a quick little final video, but before we do that, I want to tell you one quick story that I think can help us think about how we each need to lead and lead in our own way. And it's a story about a woman who introduced me to what a lot of us would call the social determinants of health. It's my Aunt Kathleen. She didn't know that term, by the way, but she spent her life helping people who bear the brunt of many of the inequities or the barriers that exist. And at her funeral, she was such an inspiring figure. At her funeral, she was described this way. And I think this is important for us to keep in mind because there's no blueprint. There's no overall blueprint that we can all just kind of line up behind and know exactly every move along the way. We've got to find our own unique way of contributing to reversing the slide and leading the nation. She was described this way, that she was a woman who encouraged us not to conform. Not to all make sure we agree, not to all be in complete lockstep. She encouraged us not to conform and inspired us to head in the same direction differently.